Thank you very much, Congressman McDermott, for holding this press conference and for your leadership on the single-payer proposal. I remain a staunch and ardent supporter of the McDermott-Conyers bill. I am very pleased with the President's presentation last night. I'm sure others this morning have told you that he made an excellent diagnosis of the problem, and now we have to get on with how we take care of providing health care to all Americans. My problem with the President's proposal, if there is a problem, is that one of the principles of universal access, one of the principles of the single-payer bill is universal access. The President has accepted some of the principles of the McDermott legislation, be it universal access, no precondition, portability, you know, the list goes on and on. But for access to be universal, it must be affordable. And my concern is that at 150% of poverty, a family would have to start paying for its 20% share of the insurance, may not make it affordable to many of the families whose needs it hopes to address. There is already a concession on part of the federal government that a family needs food stamps if they're at 185% of the poverty level. If we admit that people cannot feed their families at below 185% of poverty, how then can we expect them to pay for access to insurance at 150% of poverty? I think the President is on the right track. I think the closer he moves toward the single payer, the better. As I've said before, I hope that this plan, and when I say hope, I mean that I will join with my colleagues here in working to see that the plan that the Congress passes contains as many of the provisions of single payer as possible, that it does not foreclose on an eventual single payer, and that it does not throw up obstacles to states easily establishing their own single payer. Once again, I want to commend Mr. McDermott and Mr. Conyers for their leadership on this. Thank you. Reasons of security, reasons of savings that spring also from the simplicity of the program, savings which spring from early intervention, people seeking and receiving health care earlier in the game so that they don't have more costly health care and hospital stays. Everything points to Mr. McDermott's bill. It is interesting to see how under scrutiny, when people really take the look at these bills, how brilliantly the single-payer plan stands out. And I think it's a tribute to Mr. McDermott's endurance that he has kept this issue alive, and others did not think it was so, shall we say, inevitable. In any event, I hope that the committee, I join my colleagues in requesting from the committee the opportunity for this bill to be considered as a substitute under the rule. It has support in my community. It has support across the country. It has support in this Congress. I hope it does on this committee as well. Thank you, Mr.
But we're not here to, in any way deep six the Democratic Party. I think Joe Biden is the new brand for the Democrats, which is really good because he appealed in Pennsylvania, Michigan, and Wisconsin. So he helps us address some of those concerns that we've had.
Is there anyone you know of who will be challenging her in a legitimate challenge come tomorrow for the speakership?
Not that I heard of. So the real choice is between Nancy Pelosi and Kevin McCarthy. Nancy Pelosi, in her defense, has protected us from some of the more liberal ideas in our party. She's been there to protect us from some of those.